Welcome back, everybody, to the Aaron's High Cap Adventure Radio program. It's January 27, 2018. We're here live, and I have a special guest sitting to my left, Connie Allison, registered nurse Connie Allison. Connie, welcome to the show. I've been trying to get you on for years now.
Yeah, I know.
So it's
good
welcome
to be
the
here.
show.
Thanks. I'm an RN. I've worked in the ER as a nurse for a little over 3 years, and I've been in emergency medicine for even longer. I was an EMT for about 5 years before that.
So you got lots of practical experience when it comes to saving lives and just that quick reaction.
Yep, everything.
Quick response time, I should say, not reaction. She responds to the situation. Well, we got you on here today because I've been wanting to go over, actually I was thinking about doing some follow-up segments. I've been wanting to do this for a while on bug-out bags because I haven't spoken about it in a while. And what you need in your bug-out bag and medical supplies and people with conditions is a very important aspect of being prepared. So I wanted to get you on because you're familiar with all the stuff, what's important, and going over things that you can use that might not necessarily be used for what it was intended to, but you can use for something else. So I really don't know where this is going to go, this interview. It's going to go all over the place, so kind of keep me in check here. But I wanted to talk about, I'll give you a list of things that I want to talk about. Medical stuff for the home, your bug-out bag, things you can use for other things, tourniquets, sucking chest wounds, not breathing, no pulse. And I think that was it. Yeah, let's go over that and start it off with what you think would work best, and we'll just go from there.
All right. Well, you kind of want to assess your abilities. So if you have a little bit of knowledge, that's great, and you can use that. If you have no knowledge, then I would suggest looking up how to use different things, specific stuff, or we could do another show at some point
Sure.
on how to do that. You want to have some kind of tools to make things into other things, because you're not going to have the space to keep everything you need.
Right.
You want like a knife or a multi-tool. You can make bandages out of any kind of cloth or clothing, but what you can't make are clean bandages necessarily. So you want to have at least a few of those, and then worry about the things that are going to kill you, like bleeding to death. Those are the most important things.
Now let's clarify bandages. You've
Okay.
got sterile gauze and you have bandages. Is there a difference between a gauze and a bandage?
Well, it's all basically different forms of bandages, and then you go into like non-stick stuff. But in an emergency situation, you're not going to worry about that. It's going to be about keeping something clean and covered, and then about stopping bleeding. So if you have anything that's woven, that's going to help clot and cause that bleeding to stop. That's good. If you have an infection and you are not going to be able to get to medical care very quickly, you also want to make sure it's disinfected. So you want some kind of disinfectant or antiseptic, which you can use any kind of like alcohol. If you don't have any cleaner, you can use liquor, whiskey, or rubbing alcohol.
It depends on who you're healing or saving, right? Because you would not want to waste good whiskey on somebody who may not be deserving of that whiskey, right?
Right. I guess that would we would have to check into your priorities.
Okay. What would be a critical error, fatal error when it comes to the bandage aspect of it? One that's not sterile, you're picking up a grease rag from the floors. Obviously, that's just ridiculous what I said, but is there something that we wouldn't think about that could be very bad when it comes to the first aid people coming?
Yeah, I mean, it would depend. So, like, if it's something that's bleeding, that takes priority over infection, because you can fix infection later if you need to. So, stopping the bleeding, if all you have is a dirty rag off of your garage floor, that's what you're going to have to use. If you are not going to be able to get to medical care for a while, then you are going to be more concerned about infection, because a wound infection can turn into a full body infection or sepsis, which can kill you, and that you don't want.
Okay, so if a person is more prepared and they've got their bug out bag or they've got their medic's bag or whatever it is, and they find they should have these rags or these bandages and things like that, isn't pressure a good way to do it too, as compared to just having a bandage? Couldn't your hand on a wound actually stop it?
Absolutely. Direct pressure is the first thing you want to try. I mean, if you have, if it's your own blood, it's not a big deal. If it's somebody else's and you're concerned about that, if you have a glove or something, is nice. But if not, direct pressure is always your first line to try to stop bleeding.
Wouldn't direct pressure usually work on a cut as compared to an arterial cut?
Now, if it's arterial, it's going to be very difficult to stop with direct pressure. You're not going to be able to stop arterial blood. And the way you know the difference is that if it's from a vein or venous blood, it'll be constant, just like trickling of blood, just continuously. If it's arterial, you'll see the spurting, like
And
with
the
your
heartbeat.
heartbeat.
Okay.
Right. That is dangerous. That is the one that will kill you.
Now let's talk about
arterial
that.
bleeding.
That's
You
a
will bleed to death.
segue into your tourniquet.
Right.
Okay, let's talk about tourniquets, proper application, types of tourniquets maybe, and you were talking maybe about the medical one, or the military one.
Yeah, the cat tourniquet. That's what we use in the ER. All EMS carries it. They went away from tourniquets for a little while because they were having difficulty with people knowing when and how to use them. If you have arterial bleeding, you should use a tourniquet if you're not going to be able to get to immediate medical attention. If you don't have a medical attendant right there, you need to watch your bleeding. If you have your tourniquet on there and you're still having the bleeding, it's not tight enough. Now you want to put it on until your bleeding stops. Ideally, you may not have a pulse in that limb afterwards, but it will give you time to get to help.
People have this thought that if you put a tourniquet on and you don't let blood go through it, it's going to kill the limb. Explain that.
Eventually it will, but you can leave a tourniquet on there for a couple of hours before there's damage done. And if you bleed to death, you're not going to care if you have your arm.
That's right. Good point.
Right.
What are the different types of tourniquets? I know you can make tourniquets or you can purchase tourniquets. I know I've purchased a few different types, varieties. The one military one with the bar on it that locks is a great concept. But why don't you explain to people what they can do to make a makeshift tourniquet, and then what they can buy that's actually able to let you use your second hand.
Yeah. So if you haven't never seen a cat tourniquet, it's a big Velcro strap goes around, and then it has a like a plastic bar that you twist, and it tightens every time you twist it, and then it has another Velcro strap that goes over that to hold it. If you don't have one of those, then you can make one. You basically any kind of piece of cloth, string, rope, anything that you can cut and make into any kind of restrictive device. You tie that, then you can get any kind of stick, a pin, anything you have, stick it through underneath the strap, and then basically twist that. Now the problem there is now you're holding it. You're holding the tourniquet and you are down a hand. What you can do then is tie string around the stick through the tourniquet, but you would have to have that in before.
We're radio, but that was a good visual. Your verbiage on it was a good visual. They're going to get to see what you just did on the video, but I always try to explain it verbally so they can get a mental picture. Okay. Necessities. Talk about some things that are actually vital for the home and vital for your bug out bag, because the things in the bug out bag may not be the same that would be at the house, because the house may give you more options, whereas the bug out bag, that's it. That's all you got.
Right. At home, you're going to have more space to carry like basic medications and antiseptics. Obviously, like the clean bandages and stuff are more ideal, and they're better at stopping blood than anything. Now, in the bug out bag, some things that you can have are maybe different priorities, things that have multiple uses. Like, say for instance, tampons. A lot of women need those, right? But you can also use those to stop bleeding. Like if you get shot, you can put those in a gunshot wound.
We just had a question about this. Some people say tampons are great because you just plug the hole. But then I've heard other comments say it's going to draw blood out.
Well, they are absorbent. So what you can do is you can wrap one in plastic so that it's not sucking that out of there, but it is still something that you can push down into a wound that will hold pressure.
You're making a cork as compared to a sponge.
Essentially,
okay.
Yes.
Right.
That is the difference. That was my next point, because they kind of gone away from using those. Some people use them for nosebleeds, that kind of stuff, but they're made to absorb blood. They're not made to stop blood. Eventually it will, after it fills up, because that blood will clot. Okay. And then unless you get into where you have different clotting factors.
And at that point, you're just trying to get to some medical location that can take care of the problem. You're just trying to stop that bleeding.
Right. If you don't have that, you can use your finger. It's better than nothing.
Once again, it all depends on who it is, right? Okay.
Right.
What else can we put in that bag?
Well, let's see. We can... paracord's always good because you can make multiple things out of that. A lot of people carry a lot of that.
Let's clarify what paracord is. Ladies and gentlemen, there's different types of cord out there. You got solid cord and paracord. Parachute cord looks like all the other cord, except inside of it, it's got about 7 strands, I believe, of white nylon cord that each one of them can be used for something else. So, people make shoelaces out of them in case in a survival situation they can gut their shoelaces because they got all these nylon strings in there.
Right.
Okay, right.
And then I always like to have like some kind of plastic bag or sheet plastic folded up, because you can use that for a lot of stuff. You can use it for waterproofing your stuff. You can use it for if you're out in the elements, but you can use it too. Also, if you have like a wound on your foot, you don't want to be walking in nasty water or dirt. It can kind of cover that. Or like if you have a penetrating chest injury and you have like a sucking chest wound, it also can help to
Would you
include
clarify
that.
on that, because there's a possibility, because this is a gun show, somebody in a self-defense mode could get a second chest wound. What might be the proper procedure for taking care of that?
Well, you want to cover the hole as soon as possible. You'll basically air sucking into your chest through that wound and is surrounding your lung, making it collapse. If your lung is collapsed, it can't fill up and you don't breathe on that side. You'll see your chest movement. One side will be moving, the other won't. You'll have good air movement on that side.
And so placing the plastic over that seals the hole, causes your system to do what it's supposed
Right.
to do. Okay.
Initially, first thing you want to do is just put your hand over it, tight. Put a lot of pressure on it, and then find something else to put over
If
it.
somebody's wearing clothes, rip the clothes away from that spot to make sure
Cut
you
them
get
off.
Okay. All right. We talked about tourniquet. We talked about sucking chest wound. What about not breathing, no pulse? What can we do there?
Well, so if you find somebody that's unconscious and and they do have a pulse, you obviously want to breathe for them. You want to call for help immediately before you start, because, and then you kind of get into if it's a child or an adult. You want to breathe for them every time you would take a breath. Now, in an emergency, people's breathing patterns are all kinds of messed up. So about once every 5 seconds, you breathe for them. Now, not everybody's going to carry a mask to breathe for them, and if you also have to think about who it is, if you're going to put your mouth on them. Now, if someone does not have a pulse, compressions are most important. So you want to do compressions. It's about 100 beats a minute. I like to sing songs in my head. Staying Alive is a good one. It's got a good beat.
Okay.
It's about the same beat. And then,
Well, give us an example. If you sing the song for us, and
No. I'm not going to sing.
if you were to sing the song, give an example though of what you're talking about, the rhythm. What rhythm on that song are you talking about?
You mean like the beat of the song?
What's the beat? And
It's staying alive, staying alive.
Okay.
Okay, you got me
That's
to
the
sing
beat.
on the
So
radio.
what would you do with your hands though?
Well, so you put hands one over each
Watch.
other. Show this on the video. Mid chest. You want to lock your elbows, and you want to go in at about 2 inches. You will feel ribs break if you're doing it correctly. Because,
Really?
Yes, because your rib cage is designed to protect your heart so that stuff can't get to it. But in order to compress your heart, you have to get to it. You have to break the ribs.
Gotcha.
Bigger the person, the more it's going to take. I would recommend that every person, especially if you have children in your house or you're around people that have children, it's always good to take a CPR class. It's different. When it happens in front of you, you're not going to be able to do it if you just thought about doing it in your head. If someone told you how to do it. You have to physically do it to be able to do it in an emergency.
Are you going to know when you broke somebody's ribs?
Probably.
How?
You'll hear it.
Just sounds like a chicken bone.
Or feel it.
Okay.
And if it feels
In most cases.
And it's alarming to someone who's not used to that. The first thing
it's
you should
alarming to me
do
listening to you.
in any situation is to take a deep breath. 1 second, you're allowed to panic. And that's all you get. Else you're not going to help anybody else. So you take a deep breath, calm yourself, because your brain will not work in an emergency. In the ER, we don't panic and we know what to do based off of muscle memory.
Hold your question 1 second. Show me on the video, when you're doing your compressions, where you think my ribs would break most likely.
Well, it depends. So probably along your sternum.
Okay, so
where your hands are, because that's where you're pushing.
you know that piece down here where they all connect to? So they're gonna, okay, got you. Trey,
Yeah.
you had a question?
she's talking about, you got to keep calm.
And child.
How is that any different from what you teach in your class?
Exactly.
Well, that's right. Every aspect of life is going
It's
to
all
have
about
its training.
maintaining.
Practice.
Yeah.
That's
Practice.
it. Practice.
What's all muscle memory? When you first start as a nurse in emergency situations, you freeze, you get the deer in the headlights, because your brain shuts off and it's basic fight or flight and you want to run. Or you freeze. That's it. If you don't know what to do, because you've done it over and over and over again, you're not going to do it in an emergency. I've had so many people tell me, oh yeah, I know how to do that if my kid chokes, or I know. You don't. You know now, but
It's
they're
amazing,
not
right?
choking.
Every aspect of life has its own parameters. Like, I'm clueless when it comes to this. I mean, I know my basics, but if you were to put me in the ER, I'd probably
Because
shut down because I'm
because
like,
you
I
haven't
don't know what to
practiced.
do.
So if you're listening, you're like, oh, I can do that. That's not that hard. Sing "Staying Alive" and push on their chest. Got it. But that's essentially the basics of it. There's more technicality to it. But if you're just, that's the best you can do in the moment because you're not in a medical setting. But if you don't practice it, you're not going to be able to do it. So if that's something you're interested in or you want to do that, you should go and take the class, practice on the dummies. Because when an emergency happens, your muscle memory is going to kick in, and you're going to remember how to do it because you feel like your body do it.
I'm going to title this segment, Registered Nurse Connie Allison sings "Staying Alive."
Oh, please don't. Please
Great.
don't.
Okay, what do we got? About
No
a
one
minute?
wants that.
Oh, I don't have a fixed
Okay.
break for this one. So whenever you're ready.
Connie, we're going so fast in here. There's so much other stuff I wanted to go to, but we only talked very little about what's in your bug out bag. Give me some other ideas of what we can do there, because I want to get into the bug out bag segments in the next weeks to come, and you be the precursor as to what medical stuff would go in there.
Well, I can go into a whole list of how you pick out everything. I would suggest some kind, especially if it's for you don't in your car. If you get stranded somewhere, you're going to want some kind of water source. Some way to purify water, or I at least would keep a bottle of water in there for short term if it's meant for I'm going to be gone for a few hours. Especially if you have children, they dehydrate easier. And then you want to make sure if you have any specific medical conditions, if you're diabetic, you want glucose in there. You also want insulin, which is difficult because insulin needs to be refrigerated, so you have to think about that. You may want a separate pack that you keep in your refrigerator that you can grab with your stuff. If you have certain medications, heart medicine, that kind of stuff you want to take with you. Those are very important, and you need to take that into consideration, your personal stuff, whenever you're going.
What about the Rambo packet where you're sewing yourself? Would that be a legitimate thing to have, needle and thread?
If you feel comfortable and that you can use it. If you're not going to be able to use it, don't put it in there. It's just taking up space. Same thing with like IV kits. I see a lot of stuff where people want to put IV stuff in their bags, but if you don't know how to start an IV, then it's wasting space.
I think part of it is like one's prepared. You can't know it all. I mean, you can have a generality of it, but
Right.
you may not know it all. But hopefully, if you've got it and somebody else knows, yeah, I got that. You have it in
That's
the bag
true.
as a backup. Because a lot of times that's what I do. I'm thinking, not everybody knows what I know,
Right.
but if I'm there, I can help them, and I know they're not going to have what they need. But if I'm fortunate enough and able to have backup, I can supply them, and now I
Right.
just double my efforts.
Yeah, but Matt, you've already figured out the 8 people you're going to grab when things hit the fan.
Yeah,
So
they-
you know what skill
they
sets
know
you're
what they're
planning
doing.
for.
But you
Yeah.
never know, man. I might be
Well, I
somewhere
guess
where I don't.
that's true. So if something were to happen and I run into somebody
We
that
do a Terminator. Come with me if you
So-
want to live.
well, so like say you're in a situation and you need an IV. I don't have any IV stuff, but you have it. You don't know how to use it, but I could use it.
It's like you saying, "Damn, if I only had an IV." Hey, I got one. Square away.
That's true. If you have extra space, for sure. But if you have a limited amount of space, I wouldn't put stuff in there that you're not.
And you got to consider your body strength too. If you're not able to carry this big,
Right.
huge freaking rucksack, you got to keep it slim and trim, tight and light.
Yeah.
Okay, we better wrap this up. Connie, what can you say in the final 30 seconds or so of, I don't know, what can you tell us that would just enlighten us for the rest of the week?
Well, I would say if you have to pick one thing to carry with you, that's the most likely thing that's going to save your life. I would put a tourniquet in your car. I'd get a good cat tourniquet and I would put it in your car because it may not be for you. You might come up on a wreck.
If I only had a tourniquet, I've got one, right? There you go.
Somebody's bleeding to death. But not anymore.
All right, Connie, we're going to wrap it up. I can't thank you enough for coming on finally.
Yeah.
Hopefully we can get you on again and maybe be a progressive type of deal. Tip of the week
Sure.
from Connie Allison. And
Love to.
give us some feedback, ladies and gentlemen. She'll be on YouTube probably Tuesday. And you can check that out. Like it, comment positively. And hopefully we'll get her back on. So, Connie, it's great having you on. And ladies and gentlemen, we're going to take a break. Trey, take us out. When we come back, we're going to have the awesome Master Cindy Key beating the heck out of me, probably with some other technique. Oh, no. She's got a knife in her hands. All right, we'll see you on the other side.
Can't believe you died.